This is the last video. Congratulations, almost done. We're going to go over admissions, observation status, and discharges, as well as obtaining patient follow-up. We decided to admit Mr. Doe to the cardiology service for a congestive heart failure exacerbation. Luckily, we requested interqual early in the process, and on the track board we can see that interqual has been met, signified by the green box with the word met in the middle. If instead it showed this icon, the yellow box with IP, meaning in progress on it, we would have to discuss with utilization review if the patient can stay here or needs to be transferred. Once we have spoken to the cardiology service, we can write the request for admission order to secure the bed. The exact admission workflow will vary between sites, so please check with your site's handbook for details. Under the Place Orders tab, choose Request for Admit. Fill out the required information, such as the location. Maybe he needs to go to a step-down or PCU bed, we can choose that. The admitting service attending, I'll put myself. And under service, we will choose cardiology. Sign the order when you're ready. On the track board, a red circle will appear signifying that you have put in the bed request and the patient is now admitted to their service. Please only write this order once you have made contact with the admitting service and they know it's an admission. Once a hospital icon appears, this signifies the admitting service has written their admission orders. If your site uses observation status, write the Place on Observation order, choose the Place an Observation order, and fill out the order in the same way as you would the Request for Admit order. This will place the OBS icon under the Admission, Discharge, and Transfer column. If you think Mr. Doe can go home and you want to discharge him, first click the Admit Discharge button on the navigation bar. Fill out each section of the depart process. It will pull all of the information from your note, so if you put in the diagnosis, medication reconciliation, patient education, and follow-up, that will automatically be populated here. Let's go to the medication reconciliation. The green play button means that the patient should continue the medication. The prescription bottle means that you want to write a prescription for that medication, and the red stop square means that they should stop taking that medication. In this case, we want him to continue his furosemide and metoprolol. Under patient education, you can add or modify what educational materials the patient will get to go home on. The patient education section will automatically populate suggestions, but you can also use the search bar if you want to look for specific medication instructions or diagnosis instructions. Let's add some information about the metoprolol that he takes. When I search for metoprolol, nothing comes up. I need to broaden my search from just the suggested materials to all materials. Double-click to add, read through the information to make sure it's what you want the patient to get. You can also delete or modify things here. Click OK when done. If you already did the follow-up date information in your note, it will populate it here as well. But if you need to change it, you can do it here. Remember that this does not make an appointment for the patient, but just gives them guidelines on what they should do. The Schedule Follow-up Appointment button, when you click it, appears initially to do nothing, but what it actually has done is put a star on the track board, which is a marker for the clerk to book an appointment for the patient. If you spoke with a consultant and they wanted a specific date and time for the patient to follow up, then you should use this to let the clerk know they need to make that appointment. Make sure when you try to book a patient for follow-up in our health system that you make sure they're not out of plan. Under events, this yellow box called OOP signifies that they cannot be seen within the DHS system. Check with the registration and check the patient's insurance to see what kind of follow-up plan they should get. For instance, if a patient needs a 2-week follow-up with an ENT doctor but they have Kaiser insurance, they should be instructed instead to follow up with Kaiser. This is important because it prevents them from getting billed or turned away for an unnecessary appointment and reserves spots for people who can be seen within our healthcare system. The last part of the admit discharge process is the ED post-visit plan. This is a useful thing because it allows you to get follow-up for patients via phone. Enter in their phone number, choose the appropriate routing, in this case I'm going to choose Harbor, and then you can put in either a result or symptom check, for instance if there's a urine culture that you want to follow up the result of. Make sure you are explicit in what kind of plan you want. If they need to be referred to a subspecialty or need to be bridged to primary care, put that in the referral box and they can call the patient as well. Again, make sure that they can be seen within the DHS system if this is the case, and if they cannot and have their own private outside insurance, they should be referred to their regular doctor for further care. Once you are done, you can click the Sign and Print button to print the patient's discharge paperwork. If you have an ED post-visit plan, if you have successfully put it in, the phone icon will appear under the ADT column. When your patient is ready to be discharged, you still need to place the discharge patient order. So click Place Orders, and under Top Other, click the Discharge Patient button and sign it. The green house icon will appear, which is a marker for the nurse to know the patient can go home. So that's it. Now you know how to admit patients, place them on observation status if applicable, and how to discharge patients. The last tidbit I'll leave you with is sometimes the board can have many patients on it and it's hard to keep everything straight. So make sure you learn how to use the filters appropriately. You can filter by geographic location, or you can filter by team if you have a facility that uses teams. This will help keep your patients manageable. Thanks for watching the training, and please let us know if you have any feedback or comments about this presentation.